Chapter 6, Prenatal Influences on Healthy Development. These are the objectives for Chapter 6. State the goals of the Human Genome Project. Trace the steps of human fertilization and implantation. Discuss the critical periods of fetal development. Compare the similarities and differences among two types of twins. Discuss the importance of prenatal health and nutrition as related to the health and life expectancy of the newborn. Discuss the emotional changes that occur during transition to motherhood. Discuss the importance of understanding culture as it affects the care of parents and newborns. Discuss bonding and attachment between parents and newborns. Describe the techniques for calming a newborn infant. List the types of toys and activities that foster the growth and development of the neonate. These are the important key terms for Chapter 6. The Human Genome Project involved mapping all of the genes to determine what were the makeup of human genes. They also were able to identify all of these genes that are in the human body. And it was nice because all of these different countries came together to work on this project. Genetic counseling. So this is where a geneticist discusses with parents or one adult involved in the situation to discuss the infant's risk of inheriting genes that could result in any abnormalities in their own genes. So we have different types of therapies to deal with this to repair genes that might be defective. They can turn off certain genes, they can turn on certain genes, they can replace genes that are missing in order to hopefully address some of these issues. Fetal development occurs when sperm penetrates the ovum as it enters the upper portion of the woman's fallopian tube. Sperm can live up to 5 days, but the ovum lives for only 24 hours after the ovulation process. When the sperm and the ovum connect, that forms a zygote, and then an ectopic pregnancy is where the zygote doesn't move through the fallopian tube, so it gets stuck. After that, we have the fetus, and that is from the 9th week of life until birth. Then we have gestation, and that's the period of when a baby is actually growing inside the mother. And then viability is when basically the fetus is able to live after it leaves the mother's body. So a fetus is viable after 20 weeks, technically, even though it would have to be in the intensive care unit. Twins. Multifetal is where there are multiple fetuses. Dizygotic is where they would be fraternal twins. And they have 2 ova that are released at ovulation, and they're fertilized by separate sperm. And then monozygotic is where they are fertilized by the same sperm. So these will be exactly twins. They are going to be identical twins, whereas dizygotic are the fraternal twins. The prenatal phase is a critical period during the first 3 months of pregnancy and is very important for the fetus to receive adequate nutrition. If the fetus does not receive adequate nutrition, there's a reduction in the number of cells that may be produced for the child, They may have coronary artery disease. They may face respiratory issues, low birth rate, low placenta weight. They be more apt to contracting diseases later on in life. And then these things also affect them on into adulthood. Exercise during pregnancy is very important. However, the woman has to be careful because the joints are more lax, so she could be prone to more injury. You just want to make sure that she is protected. So the exercise might need to be modified to be light exercise. It just depends if the mother was exercising before the pregnancy and what type of exercises she does. I know it helps to go to physical therapy if the woman receives any minor injury. However, if the woman experiences any vaginal bleeding or uterine contractions, then she may need to decrease her exercise and of course see the doctor. However, if everything is going well with the exercise during the pregnancy, this can improve energy, mood, sleep, muscle tone. It decreases the risk for gestational diabetes, and if a woman already has diabetes, then it can help with managing her glucose levels. Also, exercise can help with, as I mentioned, mood, and it can decrease the risk of postpartum depression after pregnancy, and then also helps the woman's body with recovering after labor. Toxins. So these teratogens are harmful influences on fetal growth. It can cause abnormalities, illnesses, miscarriage, prematurity, mental retardation, abnormal facial features, decrease in birth weights, and toxoplasmosis. But I want you to think of more than just alcohol and drugs. I want you to think of the environmental toxins people are exposed to, depending on where they live, especially. If they're in an underrepresented area or an area where there isn't enough attention or money put into the community, they might have more access to chemical plants, which affects the mother, since when people are pregnant, your metabolism absorbs more of the chemicals, and all of that will have an effect on the baby. People might have more access to lead in their homes. So just keep all those things in mind when you're thinking about toxins harming The birth process. We have dilation, which is the opening. Effacement is the shortening of the uterine cervix. Then the baby comes down the birth canal. And then we have the birth of the placenta, which is the afterbirth. The newborn infant. So changes occur immediately after the infant is born. The lungs expand, blood circulates to the lungs to help the child receive oxygen. The cyanotic color of the skin, which is the blue color, it changes to the infant's natural color. And depending on the shade or the hue of the skin of the child, it'll take some time to get to that complete shade that it's going to end up at. And then the head is usually covered to minimize heat loss, since babies or infants are unable to stabilize their own temperature. APGAR score. This is an assessment that is given to an infant at 1 minute after birth and then 5 minutes after birth. It looks at the heart, respiration, muscle tone, color, and reflex irritability of the infant, and it's to estimate the condition of the infant and determines the need for further resuscitation efforts. So there's a score from 0 to 10, and 10 would be the best case scenario. 0 is usually where the baby is unresponsive and more than likely lifeless in some sort. The transition to motherhood. This is where there's hormonal changes and changes in self-image, since the body the woman had before has now changed to something else after, especially after delivering the child. And also the reorganization of tasks. So for people that have had a baby immediately, you don't get enough sleep because the child continuously eats or they're crying. Trying to decide what your daily task will be. Sometimes it's even hard for some mothers to get in a shower or even a proper shower. She might, bathe for like 5 minutes, but she's not taking her relaxing bath as usual. This also takes a toll on the woman's mental state. So you heard of postpartum blues. There's also postpartum depression, and then the worst case scenario is postpartum psychosis. So all of that needs to be described to the patient before they have the child. I think it'll help the patients and also whoever is the direct family member, whether that person has a spouse or a parent or whoever comes and supports this mother, they need to understand what the signs are, and so that way the mother could get help. Perez Rubin, psychological changes after birth. Now, mind you, this is a theory. So any theory could be subjective or objective in a way. So there are 3 phases, and this table is on page 85 of your textbook if you are curious. So phase 1 is taking in, and that's where the woman is passive. She lets others help her. She usually needs food and time to sleep. So that's initially after giving birth to the infant. Then we have phase 2, which is taking hold, and that's where the mother assumes a lot of responsibility for taking care of the child. For most women, it is intrinsic, so it is natural, but it is not natural for everyone, especially if they initially go into postpartum psychosis or postpartum depression, which interferes with the woman's need or aspirations to immediately take care of the child, depending on how far it is. So postpartum depression is a spectrum. So it just depends on where that woman falls on that. Postpartum psychosis is usually where the woman might be harmful to herself or to the child, or just neglect the child as far as not wanting to hold the kid. Postpartum depression usually doesn't look like that to that extreme, but that's usually what is put on TV. The mother might cry or have mood swings for postpartum depression. Now, for phase 3, letting go. So parents recognize that there's a new lifestyle and you have to figure out their responsibilities, and then they start to accept their kid is the way it is, however it comes out, whether it's the appearance or its abilities. Fathers or significant others. So if there are other siblings that are involved, it's important for the fathers to give them attention and love and reassurance, since a lot of the attention and love is going to be directed at the newborn. Also, depending on the mother's relationship with the father initially before the baby was born, that plays a role. And then there's a change in sleep patterns and routines. There's financial burdens because usually there's only one person bringing in money at the time, or depending on what type of benefits the mother has for her time off, even thinking about how long she might be able to take off, as far as funding and as far as monetary funds and health insurance goes. But there's like a new set of stresses and burdens that's placed on the family with the new little bundle. Siblings. So depending on the age of the child, there might be sibling rivalry where they want more attention from the parents. They might compete with one another. Sometimes children are old enough to be interested in the infant and want to take care of the infant, or some are really protective of infants at that age. So a 2-year-old might have low tolerance for change. A 4-year-old might be struggling. A 6-year-old might be more protective. Grandparents. So when an infant is introduced to the world, it's very important for a village to take care of the child. So it is really helpful if grandparents are involved. Culture and physical difference play a role in this. So physically, if the grandparents live in another state, that's more difficult. Also depending on the culture. So some families, depending on the culture, the grandparents might want to be more hands-on and take care of the kid while the mother does a lot of sleeping. They might bathe the kid. Some cultures, the grandparents might appear or seem to be at the point of trying to almost take over, so that becomes an issue. In some instances, the grandparents can be helpful with buying food, making sure the mother has food to eat, counseling the father involved, counseling the mother, watching out for postpartum depression or postpartum blues, giving tips without overstepping, helping out, little tricks that might help. Like I know when it came to my son when he was born, he had a little acne sometimes, not fully, but I didn't even know that I had to pre-wash everything. Some things that they're organic, but we learned to pre-wash everything before it touched our son's skin. And that included things that we would wear, or if we laid him on our bed, we would start washing with different detergent, things like that to protect him. And then also I would use breast milk to put on his skin to help clear up any rash that he might have gotten from some of the gifts that were given. Developmental tasks and responses to the neonate. So it is very important for the infant to gain trust with the parents, and part of that has to do with the feeding and the parents' responses to the infant when they need help or assistance as far as eating or needing to be soothed. So an infant learns to latch onto the breast and to suck for nourishment, and that can last for 2 to 3 hours. Also, parents that bottle feed might need to learn about the types of formulas available and then the infant's response to those types of formulas. It's very important to learn the cues that the infant or the neonate will give off, and then to respond to those before the neonate begins even screaming or crying and welling. So that's usually when the child is extremely hungry. Neonates usually will root, and that's really like they turn their head toward the breast or what would be the area where a breast would be and try to latch on. It was funny when my son did that to my husband because he was like, whoa, there's nothing in there. But that's like an example of a child trying to soothe himself or wanting to eat. Now, babies will sleep from 15 to 20 hours daily. And then just know that babies do make noise. So I didn't know that infants would honk in the middle of the night. So we learned that they make weird sounds, just depending on the child. They have their own personalities and their own temperaments already when they're neonate, and that's the first 30 days of life. So it's very important to learn your child what's normal, what's not normal for them, and then to ask lots of questions with medical professionals that may be helpful. For instance, after breastfeeding for a while, when we switched over finally to formula when I went back to work, we had to learn the different types that would be okay for our child to take, since some of them gave him acid reflux, which he didn't have with breast milk. So that took some experimenting. And then also when you do that, as far as changing breast milk, the child can become constipated, which is another issue. So just keep those things in mind. And I think it's important to talk to the expecting parents or the new parents about these things before they actually occur, so they're not startled. Development of intelligence. So this involves the ability to learn from experience and to adapt to the new environment. So on page 90 and 91 of your book, it has table 6-3, and it talks about certain reflexes of position and movement, food reflexes, responses to sound, responses to vision, when babies start to grasp, the tone of their neck reflex, moral reflex, startle reflex. So all these things that that babies experience are on this table if you're interested. Play activities and neonatal development. So a developmental task would be for an infant to learn how to follow objects in their field of vision. And this deals with Piaget's sensory motor stage of cognitive growth. So infants can learn to repeat behavioral responses. They can look, listen, touch, and this helps infants learn. So close contact with the infant is very important during these stages. It's very important to, have your face close to the infant if it's your child, of course not anyone else's child. So they could recognize your facial cues as far as you smiling or being upset at something or being confused or being surprised. Babies learn those cues from us, and then they're able to mimic them back at the appropriate times later on.